Physical therapists don't just take care of your joints, they take care of the whole body. So if you want to know how we are able to function, you can look at our Practice Act and see that we are educators. We educate about nutrition, habits, mobility, exercise, supplements. Now, the difference is it is generalized wellness, generalized information. I am not saying this specific supplement fixes this exact diagnosis. There is a problem in our country with wellness. People forgot how to be well. If you want to know what your state Practice Act says about wellness and nutrition as a physical therapist, you can look it up. And the American Physical Therapy Association has released a statement. So they're saying that they support the inclusion of nutrition as part of the scope of a practice as a physical therapist. Now, hear me out. Wouldn't you rather start to educate a patient, and if they need more, you refer them to dietetics and nutrition, an RD? Because that's what I do. I start the conversation. I sell them on the idea that, hey, wellness matters. Then, as we wait for them to find a provider, get in with the provider, they're making changes as simple as taking omega-3s. That simple. Because we know when a healthcare provider has a relationship with a patient, they are able to help change a patient's habits. A perfect example of this is when a doctor talks to their patient about smoking cessation, the patient is more likely to quit. We are healthcare providers that are supposed to help facilitate the healing process and educate the patients. Take the time if you have that ability. The way I like to think about healthcare anymore is like a Venn diagram. We all work together, and when our superpowers combined, that sweet spot in the middle is where the patient gets the best care. So if a OBGYN wants to refer a patient to physical therapy and that patient may have to wait 2 months to see me, it's okay if that OBGYN gives them a bladder journal and says, maybe start doing some stretches, maybe start doing some breathing, okay? And then by the time they get to me, I can give them a more specific routine. I can give them maybe something that is more applicable, but it is okay because we all have to help each other out, because at the end of the day, the goal is getting the best care for our patient as quickly as possible. And then as we get into the next specialist, the care gets even more specialized. We have to work as a team. And this is the way of the future if you want to save people. Hit the plus sign and follow for more women's health and wellness tips.